Hi, my name is Kristine Dawang, your nursing teacher in Australia. Incidents of aggressive, argumentative, and unwanted behavior are on the rise in medical settings. Now in this video, we will share tools and techniques for how to prevent some disruptions from happening and to deal with the ones that do. The good news is that the methods used to handle disruptive patients are often considered best practices for dealing with many conflicts in work and life. One key element to de-escalating an angry patient is to start from a place of empathy and compassion. Keep in mind that the patients who act out with aggression often feel out of control of their environment, their circumstances, and their lives. Now, the following non-verbal techniques can help you de-escalate a disruptive or angry patient and stay in control of the encounter. Remain calm, rational, and professional, but balance that with compassion. Now, being completely unemotional can seem cold or dismissive, unintentionally escalating a patient. The more a patient's emotions escalate, the less he or she can process spoken words. Look, it's not possible to reason with or problem solve with someone who is totally enraged. And if you find yourself being triggered, you may also lose your own ability to control your emotions. Meeting the high emotions of a patient with your own emotions will further escalate the situation. Remaining calm and professional will help you maintain control of the situation so you can move towards a more productive conversation. Move to a private area. It feels safe or appropriate to do so. It may help to move the patient away from public spaces into a private, designated area to talk. Allow for personal space. Keep at least 2 arm lengths between you and the patient to provide you both with adequate physical space to feel safe. Keep the room's exit clear and unblocked. Adopt non-threatening body language. Relax your body and keep your hands visible and not clenched. Avoid facing the patient directly. Doing so could suggest confrontation. Instead, stand at a slight angle if possible. Align yourself with the patient so you can do both, be physically on the same side, working together to attack the problem. Maintain eye contact with the patient. Just make sure your eye contact with the patient doesn't become a hardened state. Attempt to position yourself at the patient's eye level so that you either are both standing or both sitting. Now, these levels the playing the field for the patient and position you as an ally, not an authority to be feared or intimidated by. Try to stay with the patient during the escalation process. Unless you feel physically threatened or that it would improve the situation, avoid handing the patient off to other providers. Lots of interactions with many different people may confuse the patient and increase agitation levels. Take a timeout. If you feel as though you cannot control your own emotions, or if the patient's hostility is not manageable, tell the patient that you're going to leave the room for a timeout. Before leaving, calmly acknowledge the patient's feelings and concerns and tell them that you will return in 5 minutes and would like to start over. Once you leave the room, allow time to collect yourself. Once you've collected yourself adequately, return with the plan on how to proceed. Get help. If you feel there is a potential for physical violence, or if the patient is unable to calm down, get help. Do not let the patient know you are getting help, as that may escalate the situation further. Once you have either attempted to de-escalate or lessen the threat with non-verbal cues, see if you can determine why the patient is angry by using some of the following verbal techniques. Now, if you can identify the reasons behind the patient's anger, you will be better positioned to remain calm and provide the appropriate support. Manner of speaking. Speak in a firm tone of voice. A wavering or soft tone of voice may come across as a distrustful or weak to an agitated patient and encourages him or her to continue to rage. Speak as plainly and clearly as you can. Use short, concise sentences. Confusing or complex sentences can escalate a patient's hostility. Use active listening techniques, such as repeating their concerns, following up with open-ended questions to let the patient know that you are paying attention to them. Open-ended questions are those that can't be answered with a simple yes or no. Examples may be, "What is your number one concern?" or "How can I help you?" Paraphrase the patient's concerns back to them. Doing so demonstrates that you are listening, engaged, and acknowledging the patient's point of view. Now focus on understanding the motivations behind the actions instead of the actions themselves. This will help you empathize with the patient and understand their point of view. Examples may be, "I understand why you feel this way," or "I see how upset you are and I get it." Set boundaries. Using a neutral tone of voice, clearly establish what behavior will not be tolerated and what you can expect of the encounter. If possible, begin any negative statement with first letting the patient know you want to help. For example, "I'm here to help you and I will once you've lowered your voice." Provide the patient with options to enable them to take an active part in solving the problem. Ask them how they would like to proceed. This may not be possible with all the patients, but may help certain patients feel like they have some sort of control in their care. It positions you as an ally and provides the patient with a greater understanding of their condition and care options. For example, "We can take an X-ray today and then look at that report together. That would take about 30 minutes. Or we could take an X-ray today and then talk later over the phone and go over the report. What would be better for you?" Be factual and consistent. Repetition may be required if the patient is having difficulty focusing on what you're saying. This includes when you're setting boundaries or offering solutions. Focus on solutions, not conflicts or errors. If the patient attempts to challenge you through aggressive questions or statements, keep bringing them back to discussing the issue at hand and productive solutions. Giving attention to negative behavior just feeds that negative energy. Allow silence for reflection and decision-making. It can be helpful to allow the patient time to reflect on what is being discussed by allowing silence in the conversation. Silences can provide time for the patient to reflect, calm down, and make decisions. If a patient feels rushed into making decisions, anxiety may increase and that interaction may escalate. Ask for a do-over. If it feels appropriate and the patient is more reasonable, apologize and ask if you can start over. For example, "I'm so sorry we got off on the wrong foot. Can we start over? I'd really like the opportunity to help you." Or, "I'm sorry that your expectations had not been met by me. Would you like to start over with a different doctor?" I hope this video have helped you. In our next video, we will discuss what actions to avoid during a disruptive encounter and what actions to take after the encounter, including what to document. Don't forget to subscribe to get updated and follow our socials. Thank you for watching.